Kidney is an organ which located on each side of our lower back. Kidney is connected to an organ located below our belly button called the bladder. The narrow connecting tube between kidney and bladder are called ureter. So now how the kidney stone is formed. Generally, kidneys have the important job of filtering blood and removing waste product. A certain quantity of mineral and salt enter the urine after they have passed through kidneys. Two of these minerals are calcium and oxalate. These two components make up of 70 to 90% of all kidney stones. In people who develop kidney stones, calcium and oxalate clump together to form crystal. This crystal can, in some cases, attach to the lining of urinary tract. These clumps of crystal or stones don't cause symptoms unless they break off and start moving through urinary tract. As the urinary tract is not very wide, the moving stone frequently gets stuck, causing a partial blockage. When a blockage develops, the pressure inside urinary tract increases. Pressure equals sharp stabbing pain. People are usually surprised to hear they can have kidney stones and be symptom-free. As long as the stones are not moving or blocking a portion of your urinary tract, you usually don't feel anything. There are people walking around right now with kidney stones who are blissfully unaware of stone. Stone can remain inactive for years, but you never know when a silent kidney stone is going to start moving through your urinary tract and causing pain. Why kidney stone is formed? Why do some people have crystals that lead to kidney stones while others don't? You have mineral and salt in your urine like calcium oxalate, but you also have inhibitors or blockers that keep crystals from forming. These inhibitors help to keep crystals from clumping together to form stones. An example of a kidney stone blocker is citrate. People who form kidney stones have lower level of inhibitors like citrate. Citrate is protective because it binds to oxalate. It binds to calcium in the urine and making it unavailable to bind with oxalate. Citrate is your staunch ally when it comes to prevent kidney stones. The good news is, changing your diet can increase the amount of citrate that forms in your urine, so you are less likely to form kidney crystals and stones. Another reason kidney stones form is because your urine is too concentrated. When this happens, calcium and oxalate are crowded together too closely together in your urine. This makes it easier for them to hook up and form crystal. If you ever had a kidney stone, there's a good chance it showed up in the summer. Kidney stones are more common during summer months when people don't drink enough water. When you don't drink water, your urine becomes more concentrated. This makes it easier for crystals to form that leads to stones. Type of kidney stone. Not all kidney stones are the same. 8 out of 10 kidney stones are calcium oxalate stones. But apart from them, there are more other types of stones that are usually found, which are calcium phosphate stone between 70 to 80% frequency, uric acid stone which is equivalent to 10%, cystine stone which is less than 1% found in people. Some useful fact that should be acknowledged. Interestingly, men excrete more calcium in their urine and less citrate. This may explain why they have a higher incidence of kidney stones than women. Some people have hereditary condition that cause them to excrete more calcium in their urine. People who have kidney stones excrete too much of an amino acid named cystine in their urine. This puts them at risk for cystine stones. Kidney stones can be the first sign of another health problem. For example, people with gout are more likely to form uric acid stone. Does calcium intake cause kidney stones? Most kidney stones, as we know, are made of calcium, and people who form stones usually have a higher concentration of calcium in their urine. So, should we limit the amount of calcium in our diet? Not necessarily so. Dietary calcium from food and beverage sources helps to lower the risk of kidney stone, while calcium from over-the-counter supplement seems to have the opposite effect, based on the result of a large, well-conducted study. Actually, calcium binds to oxalate in our digestive tract, When this happens, oxalate can't be absorbed in the bloodstream, does not end up in urine. So dietary calcium reduces the amount of oxalate that gets into your urine, that because less oxalate you have in urine, the less there is to bind to calcium and form crystal and stones. That is why it is recommended getting calcium from dietary sources. That's all for today's video. In the next video, I will appear with a diet video which is about kidney stone preventing diet. Till then, please like and subscribe our channel. Thank you.